Here today. And thank you for joining us. This is the fourth panel in a series of panel discussions hosted by HSITAG on interoperability today and tomorrow. If you're not familiar with HSITAG, HSITAG is the Human Services IT Advisory Group, and it's a nonprofit organization that serves as a collaborative source of knowledge and guidance to improve the delivery of human services within state and local government. So earlier this year, the HSITAG Interoperability Work Group, we released a white paper, and it's a very long white paper, and we didn't expect a lot of people to read it, so we thought, let's do a series of webinars to cover a lot of the same topics. So we've brought a group of experts here today to talk to you about their experiences in interoperability. So you don't have to go through all the kind of pain and hardship, and especially for those of you who are thinking about starting new projects. So I'm really pleased to welcome Kristie Gordy, Senior Administrator for Social Services Division in Wyoming, Sam Thompson, Executive Director for the Health Information Exchange Authority in North Carolina, and Paul Wormeli, Innovation Strategist with Wormeli Consulting. So thank you all very much for being here, spending your time with us today. And as we begin, I'd like to start out, if each of you would please, share a little bit about yourselves and kind of the role of interoperability in the work that you do today. And let's start out with Kristie.
Thank you, Mary Sarah. Good morning, good afternoon, everybody. As you see, my name is Kristie Gordy. I'm with the Wyoming Department of Family Services. Just to make efficient use of time, I'll jump in and just talk real quickly about interoperability in Wyoming and our experience. And really, I always start most conversations I have around this topic and others around here at the Department of Family Services, our foundational philosophy in a thing basically called Why Home Matters, which is really built around working across systems and communities so that we can engage and best serve children, vulnerable adults, and families. And I think when we have this conversation about interoperability, it really is at the heart of that. And for us, those values include keeping, families and children safe at home, providing opportunities for success, and supporting those who support the families. And really for us, when we think about interoperability in Wyoming, it's not a technology effort. It's really an expression of those values I just shared with you. As families don't experience, they expect us to operate not in silos, because that's how they experience things in their lives. It's hitting them all at one time. So we've built a strategic plan and an IT plan that we can talk a little bit about more later, where really we're talking about how do we modernize technology, but look at our business processes and how we work across all the different programs that live within our agency to serve families and individuals better. And so what you'll hear me talk a lot about today is really kind of about data being an asset. You're going to hear me talk a lot about governance, and then really how interoperability becomes how we start using that. So really kind of a path of not just jumping into interoperability, but there's a lot of foundational work that has to happen before it really can be at its core and functional. So thanks, Mary.
Thank you. That's a very good point. We'll come back to that. Next, Sam Thompson.
Hey, good afternoon, y'all. It's afternoon in North Carolina. So I came to, it's been a long journey to interoperability. I started out in the School of Social Work at UNC here nearby me, and doing social work for elder adults. And we would go to their houses and kind of, see that they needed things like a ramp or services for the blind or whatever. And we would go back to the Department on Aging and leave a voicemail at services for the blind, and that was it. Right. And you wouldn't hear whether they ever got those services or whether, their lives improved, unless you went back and saw them again. And that was frustrating. And so I went on to, work for a long period of time at North Carolina Division of Public Health and got involved in data and evaluation there, and moved to North Carolina Medicaid, doing a lot of sort of data and evaluation and quality improvement work there. And all the while sort of working with data from the North Carolina Health Information Exchange and getting more and more excited about it, especially as an evaluator, the possibility of not just writing a report and presenting it or putting it on a shelf, but having real-time insights on people's health and pushing that back out to providers so that they could act on those insights. And so, about 18 months ago, I was approached about taking the job as the executive director here. And I've been really excited to do it. I think health information exchange is maybe a little bit further along, more mature than in some other sectors. And we are certainly talking all the time about how can we bring in data from those other sectors. There's things going on in North Carolina. There was a recent high profile murder where someone could have maybe been admitted involuntarily, but there was not the ability to make that decision at the time of the encounter. And so there's a lot of push right now to integrate criminal justice records with health records so that the hospital or the court can make the appropriate determination about that without a lot of processing. There's other efforts to integrate social services data. A lot of what we're navigating is how we can do that legally and what kind of state statutes we need to put in place to make that happen. So I think that's sort of where we are with interoperability. We are interoperable, but we could be much, much more so. And I think a lot of that is navigating the policy landscape.
Mm-hmm. Thank you. And you're right to touch on that healthcare is a little farther ahead than some other areas. And one of the really interesting things about this panel, and why I'm really excited that all three of you are here today, is that you're from different sectors, right? And so we've got human services and we've got healthcare and we've got justice, and you're all kind of trying to pull all of that together. And so I think that's really exciting. Paul, can you share with us?
Sure, thank you, and I'm delighted to be with you. I guess I'm representative of the justice domain, but actually I've been working in both health and human services as well as justice, and I'm really glad to hear North Carolina is thinking about how to pull these pieces together, because that's really been my career. My whole career has been about interoperability and information sharing, particularly across domains. I was involved in building the original pilot project for the exchange of computerized criminal history information. And when I was the executive director of Project Search, which built that prototype, and then the FBI began to operate that national computerized criminal history program, which they still do today. And I also was the founder and first director of the HSITAG Institute, which has its whole mission built around information sharing and interoperability. And along the way, I got involved in helping start the National Information Exchange Model program, which you all talked about very nicely in your report, which I thought was excellent. And the NEAM has now been transformed into a very revolutionary new approach to do cross-domain information sharing, like Sam was just talking about, and it's exactly the answer for semantic and syntactic interoperability across domains. NEAM Open now under OASIS is really a platform for building consensus about data standards that solve this problem of interacting between domains. And the board made the mistake of electing me chairman of the board recently, so I now have the obligation to try to figure out how to help people like North Carolina figure that out. I did spend 6 years as a strategic planner for the California Cancer Registry, so I really got sort of engrossed in the details of the data exchanges necessary to support the collection of cancer data, as well as some of the human services activity, and I worked with HHS and the Administration of Children and Families on some of the early applications of NAME, which HHS turned into actual standards, like the NEASE program, for example, that fully adopts the NAME principles, and also the prescription drug monitoring program that really involved multiple domains, including substance abuse as well as law enforcement. So my career has been all about this exact topic. So I'm always delighted to talk about it at great length. And your problem is to shut me up, not to, I guess I can talk about this longer than you have time available.
Well, and Paul, you teed us up perfectly. So the next topic I wanted to go to was to talk about standards and what is the role that standards have played for each of you, since you're coming from different spaces, and Sam, you're crossing over multiple spaces, as are you, Paul. And so have standards been able to provide flexibility for you, scalability, or have they become limiters? If you could talk just a little bit about kind of what that role is, and we'll start with you, Sam.
I think you need standards everywhere, and interoperability for sure, right? It can be a pain, and there are it seems like there's never one standard, which always makes things hard. We deal a lot with just in healthcare alone with CCDs and ADTs, so continuity of care documents and admission discharge transfer documents. US CDI, the United States Court Data Set for Interoperability, and there's quickly advancing is FHIR, the Fast Healthcare Interoperability Resource. We have to be conversant in all these standards, and the thing about being a health information exchange is you kind of have to meet providers where they are. Right. And in whatever way they can submit data that is of high enough quality to be useful to other providers and payers and so forth. So I think that what we try to do is not let it hinder us and not try and be too much of sticklers, and still kind of combine all that data into something usable in our system. And we wouldn't be able to do that without standards. At the same time, we have to be flexible. And when it comes to, embarking into other domains, I tell you, like, there's certain types of like we ingest social determinants of health screening data, and we try and stay aligned with the Gravity Project, but we also try and stay aligned with standardized screeners in North Carolina and standardized screeners that are using systems like Epic. And that can always result in, and I'm like IT adjacent job right now. So is it what people call technical debt, where you build something and then it doesn't account for how things might change, and then you have to go back and sort of rip it out and do it again. We're certainly feeling that in the SDOH space right now as the Gravity Project standards evolve. We see in the housing space that something, when I say health is more mature, we'd love to be ingesting housing data, but we see this HMIS data coming from housing and how there is no standard, not even within North Carolina. And it makes us, I think you need standards to mature, as painful as they may be.
Yeah. Okay. Thank you. And the HMIS, that's the Homelessness Information Management System, right? Okay. Paul, so how about you? You've also dealt with standards, different kinds of standards, from NEAM to, I'm imagining the Cancer Registry probably had different standards that they were using. How has that played a role?
Well, I agree totally with what Sam's saying. Standards are essential. There's just no question about it. And every discipline has developed its own set of standards. Healthcare got, started with HL7 and building those and other standards in like LOINC and other standards that applied in the health domain. Lawyers have their own language and they have their own standards. The cops have their own standards. Every discipline, education has its own standards. And what happens is that if you're going to have interoperability, there's no question that you have to have standards. That's machines have to be taught to speak to each other. They don't naturally do that. And because there are different proprietary structures and languages and the way data is represented in computers is different from thanks to all the history of our proprietary development of information systems. So when you start saying, well, we're gonna communicate between domains, then you have the problem. The challenge is how do you harmonize the semantic meaning of the data elements? You know, just think of the word case. What does a case mean to a police officer versus what it means to a judge, versus what it means to a social worker? You know, those kinds of definitions of terms and the semantics are critical. Also, the syntax is important. How do you represent them in the computer so the computers can understand each other without human intervention? You know, those are the two principles that have to come into play when you're talking about communicating or information sharing across autonomous domains. It's a lot easier if you're in one domain to do that when you can control things and you can issue orders and say, how we're going to represent this data. We have one big computer in the sky and we put all the data in it, then that's fine. There's somebody in charge. But, you know, even in the justice system, there's really nobody in charge of the criminal justice system. There's no king or ruler that says what data elements mean or what they are used between police, prosecutor, courts, and corrections, let alone between police and human services or schools. So standards are essential, and the agreement, the way to come to a consensus on what those standards mean in itself is a process that leads to collaboration. We've found over the years that, you know, if we get different domains to come and sit with each other and talk to each other and share what their needs are and how they can create ways to help each other, and they begin to agree then on the data content, and they can come to the conclusion of what we mean by terms and how we're going to represent them in computers. What the way NEAM got started in the beginning was a bunch of state and local people from various domains came together in St. Louis and started talking about the importance of interoperability. And they said, well, you know, we can come to some agreement on what these terms are, and we create a data dictionary to start with, and then we can figure out what the syntax is, and then we can, you know, start programming our computers to actually understand each other. What an innovative idea! The technology is not the issue here. It's the people problems and the will to communicate and share that lets if you get people to start sitting down and talk to each other, you know, we can come up with the ways to harmonize the data and create those standards that make it, like Sam says, not a burden, but a help in making collaboration really happen. Because that's what we're really about. How do we work together on common problems? It's not a matter of the technology; it's a matter of the people understanding what they're trying to accomplish.
Yep, that's very, very true. And I wish Kristie, she fell off because her computer decided it was time to reboot. So she'll be back shortly. But as you were talking about the people aspect of things, one of the biggest challenges and why it's so hard to get people to sit down in the first place is they believe that policies, regulation, privacy prohibits data sharing. And so there's no real purpose or value in kind of figuring it out if at the end of the day the lawyers are going to say, no, you're not allowed to share data. Can you talk a little bit about how you've been able to get over those hurdles, as I'm sure you have faced head on? And we'll start with Sam on that one.
Yeah, I don't think you're ever over those hurdles. I feel like I've been straddling a few of those hurdles today. But I think you absolutely have to think about some of these laws as an asset rather than a hindrance, right? You know, especially we're dealing in HIPAA, you have to think of HIPAA more as not a barrier to sharing information, but the rules of the road for sharing information so that if you understand it better, if you understand how to operate within it, and your staff and your colleagues understand how to operate within it, then you can start from a place of knowing what's going to be feasible to begin with. But it can be really tedious, and especially when you're trying to do something new and innovative. And the only answer I really have for that is, besides understanding it, communicating well, and trying to communicate with the right people to operate within it, is just patience. Especially with the more ambitious stuff, trying to integrate multiple systems, trying to let for example, non-covered entities see HIPAA data, or trying to integrate FERPA data into our system. We run into issues with people saying, data from school health centers is FERPA data, right? Education data, not health data. And so you run into, so with all of these things, right, there is a way there's probably somebody else in the country that has done it, and you can get in touch with them and learn from them. But there's nothing that will aid you more than patience and persistence, because it always takes a long time. It takes a lot of people to agree. If there's someone that doesn't trust you or doesn't think that you've thought things through, every time they can stop it right in its tracks. And so it takes a lot of coalition building and being friendly and patient, and is as far as I know, the only way to get there.
Okay, so governance is really and trust building. Okay. I know one county took a really kind of innovative approach, and they expanded their HIPAA umbrella. So they kind of avoided part of the issue, right, by bringing those non-HIPAA organizations under that umbrella. Kristie, what have you found effective?
Thanks, Mary Sarah. And I just apologize. I had a power outage, so you might have heard, but I'm back. So thank you. And yeah, in the privacy policy range, and I didn't get to talk about standards, I won't go backwards, but I will just say in Wyoming, as I think they kind of flow from one to another, for those that don't know, in Wyoming, our agency houses almost all things when you think of human services, minus a few. So we have all economic security programs such as SNAP, TANF, child care, utility assistance. We have child support. And then we have all social services programs to include child protection, adult protection, and juvenile justice. So it really is, at this point, really looking across all of those different programs that have different rules, all the way from the fed level down to the state level, down to policy. And so it is really looking across, saying, how are we going to do this? Just one thing I will say on standardization, I think it's essential. I think it's also essential to know you need some flexibility with that. Sounds like Sam and others have probably talked about governance. That's the space where we really started doing intentional work around data governance and what is data governance. And we started at our executive level to say, how do we, because I think we can really stall out and be comfortable in status quo when things are a little bit unknown or scary to us. And a lot of times from a business perspective, we don't know and have the understanding around data governance. And it's really taking the responsibility to learn it, own it, and build it, because without it, we really would never get to this larger interoperability that we're talking about and striving for. So with that, I think I heard Sam, when I came back on, talking about, I think we get in our own way when it comes to privacy and regulation. I will say I'm an attorney, so I am very thoughtful around what our regs and rules and statutes say. I, however, also believe that we have used those same rules, regs, and statutes as a way to say no, because saying no is easier. Saying no is comfortable. It's less risky because things happen when you share data. And so there has to be this ability to share data responsibly, which ties back to your governance structure and what does that look like and who owns and how do you do it. But I do think it's real. We have to be very mindful of it. But I do think it's a place where we stall out, because it can be, like Sam said, if you're not patient and you're not willing to do it. But I will also say, I think this is where leadership plays a really huge role. A lot of times we leave it to legal or IT, and leadership really has to step in when we're talking about these things and having clarity. You have to have a process for data use agreements. You have to know what your classifications are. You have to know what accountability is when it comes to that. And I think one of the big things that we've learned, and I think that we try to instill, ties back to what we were just talking about, is really saying, are these barriers, have we done our verification of it? Is a lot of times we just, is this a true prohibition, or is this a legacy practice? Is this a overly strict or risk adverse interpretation? And so it's trying to say, while there are real things that we have to maneuver through, there might be things that require changes to laws or regulations or statutes. But I think a lot of times at the core for us, it's been very cautious interpretation of different things that we've then said we can't share. So it really does take effort and time to really look through that and then make sure, if you are going to share, how do you do it? Have the right agreements in place, the responsibilities, the accountabilities in place, and then figuring out from a technology perspective, how and can you do that in the safest way possible. And so again, I think it really just comes down to most, at least I would say from my experience, most privacy problems are not necessarily compliance problems. They're, and Sam said it earlier, it's trust. It's a trust problem. And so I think governance builds that trust. Clarity in how we're doing our work builds that trust. And then having accountability also builds that trust, which I think then helps us move beyond talking about it.
Mm-hmm. Yeah, that's so true. And I love your comment about people get comfortable in the status quo, because when we think about cross-program data sharing, everybody's thinking about the risks of change. And it's really important that business talk about the risks of staying where we are. What harm is being done by us not moving forward? And that's something I think the business really needs to communicate. Yeah. So Paul, how have you been? What would your guidance be regarding overcoming policy and regulations? Oh, you're on mute, Paul.
Thank you. I have a habit of doing that. Kristie hit it right on the nose that it takes a governance process to deal with the issues of privacy and related security issues. The justice field has really started doing this a long time ago, really 50 years ago. Wrote federal law on privacy that has been followed ever since. And I've been working in that issue of privacy my whole life, but there are lots of ways to do this. I think the problem today more and more, and both Sam and Kristie mentioned this, that people use privacy as an excuse not to move forward. And a big thing that happens continuously, even today, is that people misinterpret the regulations and laws. Like Sam mentioned that, people use HIPAA as an excuse to not communicate. But in fact, HIPAA was written to encourage information sharing. And if you really understand that law and you take the time to understand it, as I'm sure Kristie has as a lawyer, you know that it's a supportive instrument. It's not an obstacle. And there are plenty of controls and exceptions in it to handle 90% of the challenges that you face if you interpret it right. But unfortunately, there are too many people in Kristie's profession of law that, take the easy way out and say, come up with no before they even consider yes. My approach to this has always been that we have to appreciate the contribution that attorneys can make, but they're not the ones who have to deal with the needs of the service. And it's the operational people that have the need to exchange information to do their jobs well and to improve the coordination of care across the entire continuum, which is what we're all trying to do, that have to say what the requirement is. And if the law gets in the way, and Kristie kind of just briefly implied this, you can change laws, it's not, they're not there forever. If there's an obstacle to getting the problem, getting us the ability to solve the problem the way it ought to be solved, and it takes a law to change it, then let's change the damn law. You know, that can happen at the state level. It can happen at the federal level. It's harder at the federal level, but you know, states change their laws constantly every year, and legislatures can come together and say, well, okay, we're going to have non-covered entities that are going to be a part of our communications and interoperability program in order to provide social services to all of those clients that need it. And here's how they're going to be able to share information and write that into the state law and stop the argument about why it's a problem. But people need to challenge the legislation, I guess is what I'm saying, but also first understand it and understand how it can be helped. I've been involved in hundreds of discussions about this over the years. I was at a conference at the with all the federal privacy officers from the White House to DOJ to several others, and all the young lawyers that in the room said, "Oh well, we're going to have to write these rules and we'll hold hearings, you know, so that the state and local folks can understand what we're telling them." And I and several others in the room got up and said, "No, no, no, no. You don't start that way. You don't write the rules and hold the hearings. You go ask people what they need to do and then figure out how to do it. And the good lawyers like Kristie will figure out how to enable you to meet those legislative requirements, not to use them as a prohibition and making progress." But it really does go back to this issue of trust. And that's what a good governance process does, is build trust, because you have stakeholder representation in developing those policies, and you assure the stakeholders that their voice is heard, and you begin to build that trust by having those kinds of interactive conversations so that you can confront those concerns. And privacy is something that we've had principles of privacy since the early 1950s, developed internationally, that we know what those are and they all make good sense. And the question is not making them an obstacle, it's making sure that we honor those principles in a way that allows us still to provide the services that we want to provide.
Mm-hmm. That's so very true. And I'm gonna throw a new question in here a little bit as we're talking and we've got trust. I've heard from the three of you. Are any of you, do you have consent processes in place to kind of enable that data exchange within your programs? Go ahead, Sam.
We're an opt-out system. So the Health Information Exchange Authority proper. So that means that we collect information from patients that say, I don't want to be part of this system at all. And we also have a minor opt-out process where people under 18 can opt out specific encounters, mostly related to family planning, so that if they don't want that to show up in their longitudinal health record. We are working on, and some other HIs are ahead of us on this, active consent for a number of things, in particular, the exchange of 42 CFR Part 2 data. So that is governed under slightly stiffer regulations than HIPAA. And you do have to have active consent. There were some changes to the law in 2024 that allow the data to move under a single consent between providers. And so we're standing up that. I think to the point Paul made, we've studied a few other HIs and how that's been stood up. And what we've heard is that, yeah, we built it, but it's not used at all. And that's a trust issue. Providers still don't believe it's okay for them to submit. They may not even know what's the difference between my normal clinical encounter. When is it a Part 2 encounter? And so what we've are working towards is something that's much more coalition oriented, and planning it with behavioral health providers and what it would look like to implement it effectively. So that's an area where we'll have to do active consent. We have another project called Familiar Faces that actually Wake County, which is the county I'm sitting in right now, is where Raleigh is. One has a Familiar Faces project. that that's trying to address high utilizers in the county, people that are seen a lot of times in the jail and the emergency room, in the shelters, and trying to offset those costs and improve quality of life for those people. And so they are trying to stand up a system where they can integrate with consent, criminal justice, housing, and health data, so that when they encounter one of these people at any one of these places, at a shelter, at an ED, in a jail, they can do care management and try and put them in a situation where things are a little more secure for them. And that does have a particularly complex flow where, if they're a healthcare provider, the HIE data can flow straight, they can just access it. If they're a non-healthcare provider, they're diverted to a consent process. If they get that consent, then they can look at that data on that patient, right? And we're mostly in charge of the healthcare data, but we work similarly for healthcare providers that need to view housing data and so forth.
Yeah, that's it's interesting because what you're discussing is really that actualization of a no wrong door kind of approach, and we've been working on that for 15 years, but it's still challenging.
I would, Mary, just add to that. As we're looking at it from our agency's perspective, I think we're in the midst of that. So some of it has been getting our technology. We, as an agency, picked a single platform that when we modernize every core system, it has to go onto that platform very specifically for the ability to share very easily. The ability also then to have, we are working towards an agency enterprise data warehouse to allow us to really look across. What we know is we're not just serving a family in one program and the work that we do, but the majority of them we are interacting and engaging with them in multiple programs across the work that we're doing within our agency. We also know that families that receive economic and concrete supports reduces the risk of them experiencing child abuse or neglect and coming into some type of crisis of the system later. So really, we know the majority, 60+% of our caseload when we talk about child protection are neglect cases. There's a piece of poverty to that. So part of why interoperability is so important to us and why I think you have to know your why. It's not just do interoperability because, somebody went to school in Wyoming. Oh, Sam did. But it is really knowing your why. I think that's with a lot of things out in the space. It's not just because it's the new buzzword or HSITAG put a really great paper out on it. But why is it that interoperability matters to us as an agency? For us, it's because we want to serve families better. We want to keep families and children safe. And so part of that we're doing right now is, as we have the technology, are we challenging some of prior interpretations of the ability just to share data without consent? That's happening. If we identify the spaces we might need consent, it's then working through, as we modernize technology, do we gather it from that perspective, or just different ways in which we think we need consent? But I think part of that process is also not just defaulting to we have to have consent to move forward for us, but it's also trying to be creative and think a little bit broader and try to be like, what are we allowed to do, but maybe pushing bounds a little bit that give us as an agency that oversees all of these things a little bit more ability and flexibility to share amongst ourselves. So I think that's kind of the space we're in right now. But the governance work we've done prior to now really has enabled us to be able to kind of think through these things because they are very complex.
Yeah, and that's a good point. One of the values of the policies, and Sam, you touched on it, that they're enablers for data exchange, is consent doesn't override, not giving consent doesn't override that policy. If that policy allows you to share the data, right, then not consenting, I mean, consent doesn't play a role in it, then it's the data, like you said, the CFR part 2, that then you do need the consent for. Paul, what has your experience has been?
Well, I think consent is an extremely critical issue in making it possible to have information sharing and interoperability, because if you don't solve that problem, and you're going to face not only public criticism but legislative criticism and lose your funding. It's really that simple. And from a practical standpoint, you have to face up to that reality. And it's particularly important in health and human services functions, issues of behavioral and mental health, for example, and the ability to share that information with people who are not in that discipline. And it's really the critical issue has to do with secondary dissemination. Really, it's within an agency, you have the ability to collect the data you need to do your work. But how you share it and what that agency you share it with does with it is where consent becomes critical. I've been very involved in this. I helped as a consultant to the Vail Police Department. We tried to create a project to keep people out of the criminal justice system and sharing with mental health and behavioral health agencies enough data to do that. And that's the first thing we had to tackle was a consent agreement to, let's decide how do we provide those people who need mental health or behavioral services access, that access to the police department to not continue to prosecute them if they're, being handled by the health or human services organizations involved. And it takes a while to work that out in every case. The IHS Institute did a project in California recently to get schools and juvenile justice and social services all to agree on with how to share data on children. And the consent agreement there was very difficult. I'm on the board of directors of an organization called Stewards of Change Institute, which is a nonprofit that's focused on this issue. And Stewards has done a lot of good work on defining what a consent utility might look like. And actually, California has now adopted the Stewards of Change model to try to build a statewide consent utility, basically across both health and human services, which is no simple task. But the idea of having a utility that works across all of the different services, it allows you to do what Kristie said, of to deal with that data that doesn't require consent first, and then make sure that for the data that really should require consent, and the ability to opt out, as Sam was talking about, as well as the ability to inform people what the sharing is doing is really critical. All those factors have to be taken into account, and it's not a simple task, but it's one that has to be addressed. If you're going to talk about cross-agency sharing in this day and age, particularly with all of the publicity about how is AI going to screw that up, we have to face that in great depth, and it's an evolving field at this point in many ways, because we don't know how this is all going to happen as a result of agentic AI.
Yeah, thank you, Paul. And I want to see if we've got any questions out there. Debbie, is there any hands up, any questions?
Not seeing any hands.
Right, no.
Okay, all right. Then for the last question, cover really quick, kind of the lightning round here. Given the fiscal and regulatory environment that we are in today, what single piece of advice would you give to those organizations that are thinking about expanding their work or initiating new work, perhaps with HR1 or with CalAIM in California, or for behavioral health, which is we're seeing across the country? What would your piece of advice be? Who wants to jump in there?
I can. I think I already gave it.
Oh, Sam, we can't really hear you.
Why doesn't somebody else go, and then I'll figure mine out.
Okay.
Mary Sarah, there is a question in the chat.
Okay. Our question in the chat is, are you utilizing the FHIR standards for any of these use cases? I don't know, Sam. I know you are. With the
Can y'all
gravity.
hear me now? Any better?
Yes, we can hear
Oh,
you.
yes, we are using Fire more and more. I think Fire is a little more flash than substance still. Like a lot of entities talk about using Fire, but for example, for the vast majority of our provider integrations, and we are integrated with like tens of thousands of providers. The the they're not ready to use Fire for their primary data exchange. It's HL7, it's ADTs and CCDs, and even flat files. But for certain things, like we're participating in CQA's data aggregator validation program, right, to for quality measurements, so we can observe whether the data that went into a source system, like a provider's EHR, is the same data that we might get that we would pull out of the HIE at this end after it's been sort of normalized and you know put it in a patient's longitudinal health record. That we can exchange data, Fire data that way. We have a hospital pilot where we're exchanging SDOH screening data via Fire. One of the big Fire use cases now is claims data exchange, so exchanging data with payers, claims data. We're not doing that yet, but in order to take some steps forward, I think we have a plan to do that with some commercial payers. So we're getting there. I don't want to give the impression that we are like sort of super duper Fire advanced. I don't think we are. I think it's something we're learning on the job kind of. So yes, we are using the Fire standard some, but not a ton.
Great, great. Well, thank you. I'm sorry we have gone over. So I really appreciate everybody joining us today. And thank you so much to Sam Thompson, Kristie Gordy, and Paul Wormeli for being our panelists. I hope this was valuable. And please, if you missed any of the sessions in the webinar series, they are available, HSITAG.org, and you can see the videos. Thanks so much.